Good morning, students. Today's class will be on the blood supply of brain. So the brain is the principal organ that is going to control the entire human body. Let's do the blood supply of the brain, where we will see the arteries, mainly the vertebral artery and internal carotid artery giving its branches within the cranium, and the anastomosis between these arteries become the principal arterial supply for the lobes of the brain. Let's go into the class. The learning objectives today will be the supply of brain, the blood supply of brain, the formation of the circle of Willis and its applied anatomy. Let's do a small test. The arteries that predominantly supply the brain will be internal carotid artery, basilar artery, vertebral artery, or all of the above. Whatever you think is the right answer, you can give the answer in the comment sector below the video. Let me talk about certain interesting features to you about the blood supply. The brain is the organ that receives 1/6 of the total cardiac output and 1/5 of the oxygen that is supplied to the brain. The total oxygen that is being circulated all around the body, 1/5 of it is absorbed by the brain. And in 1 minute, there is around 750 ml of blood circulating around the brain. There is around 750 ml of blood circulating around the brain. Principally, the brain receives blood from the carotid and the vertebral artery. Principally, it is the organ that is receiving its blood supply from the carotid and the vertebral arteries. Let's go into the internal carotid artery. It's one of the terminal branches of the common carotid artery, which is known to you, and it divides into the internal carotid and external carotid at the upper border of the thyroid cartilage. It ascends into the cranial cavity through the carotid canal, which is present in the base of the skull, and within the petrous part, when it enters, it gives an S-shaped uh, curvature, which is referred as the carotid siphon. The carotid siphon is nothing but the S-shaped pooling of blood, and which is clearly visible in the angiogram when you do a cranial angiogram. So there, the internal carotid artery will form an S-shaped siphon-like structure, and later it starts to give its branches. This siphon, carotid siphon, is present within the petrous part of the temporal bone. Coming to the branches, the superior and the inferior hypophyseal arteries are the two major arteries that supply the pituitary gland, and it is the first branch that is given from the internal carotid artery. So the first branch, easy to remember, is the artery given to the pituitary gland, superior and the inferior hypophyseal arteries. Next is the ophthalmic artery. It enters into the bony orbit through the optic canal, and it gives branches along with the optic nerve. It gives branches to the lacrimal gland, long and short ciliary branches. It gives branches to the lacrimal gland, long and short ciliary branches, and it is also one of its branches also joined with the optic nerve as the central artery of retina. This central artery of retina is an end artery and plays a very important role in the vision. Whenever there is any thrombosis or clot within this artery, total blindness usually occurs. So, a very important branch of the ophthalmic artery, that is the second branch given from the carotid. So, what are the first branch? The first branch is the superior and the inferior hypophyseal arteries, which is supplying the pituitary gland. The second branch is the ophthalmic artery that supplies the orbital cavity, mainly the eyeball and the lacrimal gland as well as the ciliary branches. It is also an artery that supplies the optic nerve along with the central artery of retina. Coming to the next, anterior choroidal artery. The anterior choroidal artery is an artery or a plexus of vessels that supply the lateral ventricle. So every ventricle in the brain has its own plexus, choroidal plexus, that is present within the ventricle, and that we call it as a choroid. So here the anterior choroidal plexus is the plexus which is located within the lateral ventricle. The next is the posterior communicating artery. The posterior communicating artery connects the internal carotid artery with the posterior cerebral artery. Posterior communicating artery is an artery which connects the internal carotid artery with the posterior cerebral artery. It contributes to the completion of the circle of Willis. The posterior communicating artery is a small artery that is going to join the internal carotid artery with the posterior cerebral artery, and it will form the complete end of the circle of Willis. Now this branch is what we learned now will be seen as a diagram. Before we go into the anterior cerebral artery, let me show you the image. See, this is the image of the brain. At the base of the brain, what you find is, you find the two internal carotid artery giving the major branches. That is the ophthalmic artery is one branch here. See, this is the ophthalmic artery that is given. This is the ophthalmic artery. These are the two internal carotid arteries. These are the two internal carotid arteries. And this is the artery that is given as the anterior communicating artery. This is again another anterior communicating artery. See, the two anterior cerebral artery is being joined by the communicating branch. That only we call it as the communicating artery. There are there are two arteries called anterior cerebral arteries, and they are joined by a communicating artery. Then you also have another branch that is given out from the internal carotid artery, what we call it as the anterior choroidal artery. The anterior choroidal artery will come down to form the uh, posterior cerebral artery, and the posterior cerebral artery will be joined together by the posterior communicating branch. Lower down, you also get the posterior cerebral artery, which is seen. This is the posterior cerebral branches. And the next second branch, what you see is the superior cerebellar arteries. Cerebellar artery is given for the cerebellum. Then, if it's continuing lower down over the brain stem, these are the small pontine arteries which is resting over the pons in the brainstem. Then lower down pontine artery, you get one artery called the basilar artery, which is formed by the fusion of the two vertebral arteries. This is how the branches of the internal carotid artery is forming an anastomosis with the vertebral artery, and it forms the circle of Willis. If you carefully note the circle of Willis, also this is the circle of Willis in the brain. It is located in the base of the brain, and it is located between the temporal. See here, this is the temporal lobes bilaterally, and this is the cerebral hemisphere. This is the olfactory bulb. This is the olfactory bulb area, and this is the optic nerve, optic chiasma that is seen over. This is the optic chiasma area. This is the pituitary gland area. So exactly over the space of the optic chiasma, you find the circle of Willis resting, and it is present between the temporal lobes. It is seen exactly above the pons. It is seen exactly above the pons and the medulla oblongata. It's exactly seen above the pons and the medulla oblongata. And on the either side, what you get will be the cerebellum. Look at this diagram, what has been given to you in comparison. This is the internal carotid artery, and these are the two communicating arteries that participate in the circle of Willis. This circle that is formed is called circle of Willis, and the circle of Willis is formed by the anterior cerebral artery bilaterally on the right side and the left side, which is joined together by the anterior communicating artery. And lower down, what you get will be the posterior cerebral artery. The posterior cerebral artery will be joined by the posterior communicating artery. And lower down here, you also get another horizontal vessel that is coming out, that is the middle cerebral artery. So here you find the posterior cerebral artery bilaterally joined by the posterior communicating branch, and below that what you get will be the branches that come up from the basilar artery. What is basilar artery? The basilar artery is the artery that is formed by the union of both the vertebral arteries. The right and the left vertebral artery joined together to form the basilar artery, and they give the pontine branches and the cerebellar branches. Pontine branches and the cerebellar branches. Coming back to the anterior cerebral artery. The anterior cerebral artery is the artery which is going to form the upper part of the circle of Willis. The anterior cerebral artery passes anteriorly towards the median longitudinal fissure. The two arteries are connected by the anterior communicating artery. Then it passes over the superior surface of the corpus callosum, and then the anterior cerebral artery supplies mainly the medial surface of the cerebrum. So the corpus callosum is a junctional tissue that is present between the two cerebral hemispheres, the right and the left cerebral hemisphere. Among the branches of the anterior cerebral artery, the recurrent branch is of immense clinical importance. The recurrent branch is given more of importance because it is a vessel that is which carries more of clinical importance. It has applied aspects whenever there is a thrombosis in that region. Next. Coming to the middle cerebral artery. The middle cerebral artery is the artery which is seen parallel to the internal carotid artery, which is an artery that fuses with the anterior cerebral artery, and it is supralateral to the cerebrum. It is in the posterior ramus of the lateral sulcus. It supplies mainly the supralateral surface of the cerebrum except the area of the supromedial margin, along with the branches of the middle cerebral artery, that is called as the lenticulostriate arteries. The middle cerebral artery is otherwise called as the lenticulostriate arteries, which is of immense clinical significance. Lenticulostriate arteries, the medial and the lateral striate branches that pierce the anterior perforated substance. Next comes the medial lenticulostriate arteries that ascends through the lentiform nucleus. The second is the lateral lenticulostriate arteries that ascends through the external capsule and then turn medially through the lentiform nucleus to supply the caudate nucleus and the internal capsule. So the medial lenticulostriate vessels and the lateral lenticulostriate vessels are the ones that supply the external capsule and they turn medially to form the lentiform nucleus. And then they supply the caudate nucleus and the internal capsule that is seen within the cerebrum. Then the next artery which is seen below, that is closer to the foramen magnum, the vertebral artery is an artery that ascends upwards from the cervical region. Ascends upwards from the cervical region. It is a branch from the first part of the subclavian artery. So, you know, subclavian artery is an artery that is given from the arch of aorta, and one from the from the arch of aorta, and it ascends upwards by dividing itself into three parts. So, the first part start to give the vertebral artery, and the vertebral artery will ascend upwards, and it supplies. It goes to the neck and through the cervical region, that is the neck region. The vertebral artery enters into the neck region through the foramen transversorium. There is a foramen for the vertebral artery which parallelly enters on either side, right side and left side, and then enters into the foramen magnum along with the spinal cord. And then when it is lying over the brain stem, it fuses the right side vertebral artery anastomosis with the left sided vertebral artery, and it forms an artery called basilar artery. The basilar artery will lie over the brainstem, and the basilar artery will start to supply the brainstem. So, it supplies the brainstem, the cerebellum, and the occipital lobes of cerebrum. So, what are the areas the vertebral artery supplies? It supplies the brainstem, the cerebellum, and the occipital lobes of the cerebrum. The artery has four parts mainly. The first part ascends from its origin to the foramen transversorium of the sixth cervical vertebra. So, from this first part of subclavian, until it reaches the foramen transversorium of the cervical neck region. That region is called as the first part of the vertebral artery, and then later from the sixth up to sixth cervical vertebra, it ascends upwards through the foramen transversorium. Then the second part of the artery ascends through the foramen transversorium from the upper sixth cervical vertebra and then enters into the foramen magnum. So the second part confines itself from C6 up till C1. Okay, so this is in the upward direction. So the first part is from the origin of the first part of the subclavian artery up till the foramen transversorium of the sixth cervical vertebra. Then the second part is from the sixth cervical vertebra upwards towards the foramen magnum. It is the second part. Coming to the third part, once it enters into the foramen magnum in the occipital area, see, it appears in the suboccipital triangle and then appears passing through the posterior arch of the atlas of the vertebra, and then it will pass through that portion of it present in the suboccipital region is called as the third part. Then it is lying posterior to the arch of the atlas of vertebra, and the fourth part is the right and left vertebral artery ascending along the ventral surface of the medulla oblongata. At the junction of the right and left vertebral artery, it joins to form the basilar artery. This is the diagram that shows it, and here you find the right and the left vertebral artery entered through the first arch, through the first cervical vertebra, and then entered bilaterally, and then it joins together to form the basilar artery. It lies over the pons to give the pontine branches, and then it starts to supply. This is a diagram which has already been discussed with you. So this is the anterior cerebral artery that has been contributed from the internal carotid artery. This is the middle cerebral artery again from the internal carotid vessels, and this is the posterior cerebral artery. So posterior cerebral artery all together they form the branches from the vertebral. So they join together. There is an anastomosis in the brain, base of the brain, between the vessels of the internal carotid and the vertebral arteries that form the circle of Willis. So this is the this is the angiogram that shows the circle of Willis very carefully. When they inject a dye and when they study the circle of Willis, here you can see the anterior cerebral artery very clearly. This is a small anterior communicating branch, and this is the internal carotid artery. This is the middle cerebral artery, which is the second branch from the internal carotid artery, and this is the posterior communicating artery, posterior cerebral vessels. This region is the junction between the posterior cerebral artery, and the circle that forms in the center is called as the circle of Willis. So you also have the branches from the posterior cerebral artery which comes out from the vertebral artery. The vertebral artery is bilaterally present and they join to form the basilar artery. Here you find the formation of the basilar artery here, and the basilar artery in turn gives the branches to the posterior cerebral artery, and they take part in the union between the branches from the internal carotid vessels. So thereby it forms the circle of Willis. So coming to the veins, the first vein is the superficial middle cerebral vein, and it lies superficially in the lateral sulcus. Anteriorly, it drains into the cavernous sinus. Posteriorly, it communicates with the superior sagittal sinus through the superior anastomotic vein, which is called as the anastomotic vein of Troland. And then the transverse sinus is the next, which directly communicates with the inferior anastomotic vein of Labi. First is the middle cerebral vein, or otherwise called as the superficial cerebral. It is called as the superficial middle cerebral vein. Then we have the deep middle cerebral vein. So the middle cerebral vein is getting divided into a superficial middle cerebral vein and the deep middle cerebral vein. Superficial middle cerebral vein drains itself into the cavernous sinus, and it is called as the vein of Trollenden posteriorly. And the transverse sinus, which lies with the inferior anastomotic vein of Labbé, is called, which is closed and it drains itself into the transverse sinus. The middle cerebral vein is a vein, deep middle cerebral vein, lies deep to the lateral sulcus and joins with the anterior cerebral veins to form the basal vein. The deep middle cerebral vein lies deep in the lateral sulcus and joins to the anterior cerebral vein to form the basal vein. Coming to the great cerebral vein of Galen. The great cerebral vein of Galen is 2 centimeters in its length, and the union of the two internal cerebral veins join to form the cerebral vein of Galen. It receives two basal veins. The two internal cerebral veins join to form the great cerebral vein of Galen, which is the straight sinus. Then it drains into the straight sinus. So here you find that the dural venous sinuses are all being interconnected by the veins that drain the cranium. So here you get the thalamostriate vein, the internal cerebral vein. This is a vein arising. This is the vein of Galen from the. This is the vein of Galen, okay, which is marked here, and it is supposed to be the major veins that drains itself into the straight sinus directly. See here, this is a vein of Galen that is draining into the straight sinus. The straight sinus in turn is it's connected by the confluence of sinuses that drain into the superior sagittal sinus, and then later into the superior and inferior sagittal sinus is also interconnected. Here you find this cavernous sinus is interconnected with the petrosal sinus, and petrosal sinus is interconnected with the jugular vein. Jugular vein drains itself into the petrosal sinus, and later they are interconnected. See here, sigmoid sinus also drains itself into the jugular vein. Through the jugular vein, the cranial vein, venous blood is drained through the jugular vein to the internal jugular vein, carries it directly into the SVC, superior vena cava, for its purification. So let me, okay, you can rate the lecture as a comment in the video, and you can also ask me if there are any questions. You can also post the questions what you have, doubts what you have in the topic. After the class, Google form will be shared to you for the assignment work. It is a quiz which is shared to you. The quiz will be open only for 30 minutes. I will open up a document, a Word document, which contains a few questions from the blood supply of the brain. It's a very short topic. So I will give you time up till maximum of 1 hour for you to go through the class and the topic. In the afternoon by 2 o'clock, I will post a questionnaire. You're supposed to answer the questionnaire and resubmit it back by 4 p.m. in the evening. Do not submit the form after 4 p.m. and I will stop accepting the responses after 4 p.m. It will be shared to you by 1 o'clock in the afternoon. So the time given to you is to go through the topic in the textbook as well as to go through the lecture that has been posted in your group. Sincerely do it and answer the questionnaire for your evaluation. Thank you.